touring, but it was so successful out there. And again, it could be partly to do with the production values that we talked about earlier as well, because the stuff, and the same with Kenya's, the programming out there is so bad that when you, in terms of quality that is, that when you put shows like this across, the acting in Kenya is brilliant. The acting in Tribes in Trinidad is so bad, it's unbelievable. But the production values is so high. It was a famous director. It went down really, really well. Then we did a 30-minute short in the Ukraine, which as well, it was shot on film, so it looks absolutely amazing. And if I told you the budget for that show is astounding. It was so cheap, it was unbelievable, but it looks beautiful. The story is crap, but it looks beautiful. I can say this honestly because I've seen them all. But a lot of it is dictated by our partners. That's where we're very different from the other networks and the shows that they do, because we do give our partners a lot of say. But it's a problem in allowing them to have that, because we do still keep creative control. So there's some, I mean, the sex scenes that were originally in Sugar were, well, let's just say we were like, okay, maybe we can't air this after all. And we did cut it down tremendously. But there's always this battle between, like Surgeon was saying, that when you're working with a UN agency, they want to make sure the message is correct. They want to be safe because they don't want to get in trouble with the government and whatever. Whereas we're MTV, we always want to push the envelope. We're like this close to being banned in countries. That's what we want. We want to be this close to being banned, but not really banned. But it's that fine line of doing something that is creative and edgy, but you can still put across a message. And, what we did with Sugar is it wasn't just on air, it's an online component as well. We went online in Kenya and Zambia, which were the two priority markets for Sugar. We did radio shows as well. And the one area that we still haven't managed to figure out how to use successfully is mobile. Because obviously for Africa, mobile's that's the largest growing market for mobile communications. So it's figuring out how do we incorporate mobile, and especially because largely now everything MTV does has to have a 360-degree offering. So it is figuring out how do we use mobile to reach young people as well. But every year it's, the stories are, some of the stories you hear are completely heartbreaking. Young people are doing some of the most amazing work on HIV and AIDS on the ground. And, our responsibility is how are we telling those stories and putting that across? How are we still getting young people to want to use the condom or to be able to say no to sex if it's not protected? But still doing it in a way which is entertaining and credible, because that really is the challenge. And each year we're trying to find different formats and ways to reach our audience. And of course, because when we first started doing Staying Alive, the huge issue UNAIDS had is, but you're a cable network or you're on satellite, you're only for the rich kids. We want our messages to reach all young people. And so that's why we came up with the rights-free strategy. But it's now got to the point where we're like, okay, but hold on. Our job is to create a program. Your job is to take it and reach these young people. Take it into schools. We've given you the license to do this. We are not the community mobilizers. That's not our role. Our role is simply to facilitate this discussion and to help you leverage the messages in a way that young people are going to find that they can digest it and actually respond to it. That's what we do. So partnerships is definitely very, very key for us, because there's only so much we can do. And there's a lot of sharing of information. I think if you look at all the programming shown today, is that creatives do one job, which is phenomenal, and this health and Hollywood Hollywood and Health Society and all our funders, they come in and bring the technical information, and those two have to be married. One can't do both, and they need to work together, and I think that's something that we have learned over the years and will continue to do.
Kathy, do you have any information from the countries where you air your programs about policy impact?
Not really, but I can say that it's getting a lot easier to get funding and to work with partners. So I'm guessing people are seeing the benefit. And you go into more countries now, and they're definitely using a lot more entertainment media to get their messages across. So I think there's definitely some benefit, and it's slowly trickling down.
Okay, thank you. Okay, now we'll go to Anjanette, and we'll see a clip from Amarte Así. Is that right? Let's see.
No, don Pedro, no hay cura. Pero no se asuste. Siguiendo mis consejos y los cuidados que tiene que tener, es una enfermedad que se puede sobrellevar muy bien. Usted puede llevar una vida normal.
Ignacio, necesito más información, por favor.
Lo que tenemos que hacer es controlar los niveles de azúcar en su sangre. Yo le voy a regalar un aparatito que le va a ayudar. Todas las mañanas se va a medir usted el nivel.
¿Debe llevar alguna dieta?
Sí, por supuesto. Pero lo más importante es la actividad física. Ahí vamos a poner el acento. Y también necesito que se tome sus medicinas.
Tengo hambre.
En la mesa te puse jitomate y zanahoria. Con eso tienes hasta la cena.
¿Y eso es comida?
Sí, Pedro, es comida. Acuérdate de lo que te dijo el doctor. Tienes diabetes. Vas a tener que cambiar algunas cosas para que tengas una mejor vida. ¿Ok? ¿Me quieres dejar viuda?
No. Tomate y zanahoria está bien.
Y las caminatas son muy importantes para controlar la diabetes. Así es que no te quejes. Yo te dije que ibas a tener que cambiar tus hábitos de vida, ¿eh?
Sí, ya lo sé.
No solo no cuidas tu dieta, también me enteré que no te aplicas la insulina.
Bueno, no digas eso, por favor. Se me olvida de vez en cuando.
No me mientas, Pedro.
Papá.
What you don't see there is that the only reason he began to even seek help in the telenovela is because he wanted to get married and he was suffering from impotence. And that was the only reason that the writers agreed to include it. I've been pushing that, talking to them about the importance of integrating storylines about diabetes, and they just said, it's just not sexy. It's just, diabetes. So everybody knows about it, everybody knows what to do. And then Hollywood Health and Society, and I didn't even work with them then, said, it's the #1 cause of impotence among Latino men. And so then we had a bidding war. Every telenovela writer, we had 4 teams at the time, were vying to include it. Drama, right? Conflict. How can I tell you everything that's in my heart in 10 minutes? I want to give you guys something to take with you. I've heard the creators. I've heard the research. You all care so much. I was telling Sheila, I've never heard anybody say that data was beautiful. That to me is impressive. And, to say with that passion, that enraptured, beautiful data. So I want to give you some data of sorts. And I know to this group I don't have to explain why it's important to know about the Latino market. If you've walked into Kmart and heard, atención Kmart shoppers, you know, that every day more and more, I think the census is going to come up with like some 48 million. And we don't just watch Spanish language television. We are more and more watching other languages as well. So I want you guys, if you have some paper, just really quick, take pencil. I'm gonna try in less than a minute to explain to you the whole panorama, if you will, of primetime narrative, Spanish language primetime narrative, and how maybe some of those lessons can be transported to what you do, whether you're a researcher or a writer or a producer. Make 2 circles and have one here and one here, maybe about this distance. On one of them, put Univision, on the top one. On the bottom one, put Telemundo, or if you don't know how to spell it, just a big T will do. That's their logo. Okay. Those are the 2 main Spanish language news networks in the U.S. Now, out of this circle, go ahead and unite another little circle and call it Telefutura. Again, Telefuture, if you will. It's a smaller network that's owned by Univision. And then offshoot of Telemundo, make a little circle and put Mundos. And immediately after you make the circle, go ahead and cross it out. The reason I'm going to say to cross it out is because it's not available on open television nationally. It's cable. So you really have 3 networks. One of them, which is very small and in terms of ratings doesn't really get out there enough. You really have 2 big players, right? So then Univision, the one up here with the big ratings, has an exclusive agreement with Televisa of Mexico. They get all their primetime narrative series from Mexico. None of it is produced in the United States. Absolutely none of it. Okay? So that presents a problem. They're now creating a studio, and eventually they will be producing things here, but right now, no deal. Telemundo does produce things in the U.S., and I would say right now, it used to be more, it used to be 100%, and right now it's maybe down to 30, 40. So both of them are using partners, meaning Univision uses Televisa, and Telemundo uses Caracol in Colombia, so you can do a Colombia little circle offshooting Mexico, and they buy some things from Globo in Brazil. So really the only place where you can impact Spanish language Latinos, and I'm going to explain what I mean by that, and I'm not being redundant, in the U.S. is really, if you want to just limit yourself to series or telenovelas or fictional programming per se, is Telemundo, which is not even your highest impact player, right? So I tell you all of this so that we can look at 2 very important things. One, logistics, and I'm going to go into that in a minute, and then magnifiers. And magnifiers is where the gold is, and I think some of the lessons from the magnifiers that I'm going to tell you, you're going to be able to apply to English language television and some of the interactions that we have. So that is the landscape. That is TV. TV is number 1 with Latinos. It's the strongest media. But not only that, the actors of telenovelas are the ones they remember from home, because Mexican telenovelas are exported all over. So you're seeing Univision, you're seeing that telenovela, and it reminds you of home because you used to see that same artist back home. So there's a very emotional tie in these telenovelas that are brought from outside, that are hard. They work really well because of that. So all these things that you're talking about that you're encountering globally, we're encountering that in the Spanish language market. It's sort of like, this is like your little guinea pig for for what's happening globally, okay? So once you understand all that, and then we add all the logistic issues. For example, Dawn had the great fortune of having a wonderful boss that, wanted to give her time to read it, actually took no for an answer several times. And that's not exactly the situation. Amartya C was written by 2 people. All of it, all 150 episodes of it was written for 2 people over 3 or 4 months. We had something called the War Room back then, and they would be monitoring the telenovela of the competition because they could, since it had already aired in Mexico, right? And when something really big was happening over there in Mexico, they would go to the writer and say, I need something big to happen. I need a game changer. Well, the game changer is a very dramatic scene. So, you kill somebody, you marry somebody, you have a child. I'm sure you were able to guess that the doctor found out later that this was his father and he didn't know it at the beginning. Yeah, that never happens in Spanish telenovelas.